what is a sty? Well, in the medical world, we don't even call it a sty, we call it a hordeolum. And a hordeolum means an infection of one of the glands of your eyelid. And you can have two different types of hordeolums. You can have an external hordeolum, where it's an infection of the gland of Zeiss, or the hair follicle, or you can have an internal hordeolum, where you have an infection of the meibomian gland, and that's the oil gland on the inside of the eyelid. And since it's an infection, the sty or a hordeolum is going to be red, kind of swollen, and painful. And if you do have an external hordeolum, or the true sty, then it could even form a whitehead and look sort of like a pimple. But it's not a pimple, and you should try not to pop it under any circumstance, because if you try to pop it like a pimple, you could end up pushing the pus further deeper inside of that infection, and that could cause the infection to spread, becoming a preseptal cellulitis or worse. So definitely don't do that. So this infection of the eyelid is most commonly caused by the Staphylococcus species of bacteria, and since it's a bacterial infection, the number one best way to treat this infection is with an antibiotic. And so if you are having a sty and you want to get this done with right now, right away, make sure you go see your eye doctor and get treated with an antibiotic. It's largely accepted that the best antibiotic choice is an oral antibiotic, so taking an oral medication is going to help this recover much faster. In rare cases, a topical antibiotic may be prescribed, but that's usually in cases of the external sty that has already ruptured and some of the pus is leaking out. Or it could be because a person has an excess amount of what's called blepharitis, which is the overgrowth of the normal flora bacteria that live on our eyelids that eat all the dead skin cells and oils. And if someone has an excess amount of that bacteria, they may be at higher risk of either developing more styes or styes in the future. So on occasion, yeah, a topical antibiotic may help. However, even though 9 times out of 10, most of my patients who are coming in, I do end up treating them with some form of oral antibiotic, there occasionally is somebody who doesn't want to take antibiotics. An eye mask such as this one. This happens to be the one that I'm using, called the Brooder eye mask. You
هذا
can, of
ماسك
course, shop
للعين
around. There's other different similar brands.
لتسخينه
But these
بالميكروويف
ones I like because they did make it really easy to put in the
عشان
microwave,
يحطوا
heat it up for
الشخص
about 20
المصاب على
seconds,
عينه.
and then you can actually put it on, and it holds the heat for at least about 10 minutes or more. I get these that have figured out a way to kind of bottle and keep this solution stable. The two most stable on the market is Acuisin as well as Avenova. These two are fantastic. They are basically the most pure on the market and the most stable. That I'll mention is called Hypochlor, and that's by the Ocusoft
هذا
company.
الأوتيسي products.
It does work pretty excellent. Also the Hydrate by iLove. This is another hypochlorous acid solution. I think both work effectively. They're pretty much the same. However, the Hydrate solution, you can find a lot of good deals. A lot of times they have good. When you use it, you can choose to either spray it directly onto the lid, the closed lid itself, and then wipe with just a piece of tissue paper and wipe away from the eye, or you can put it straight onto a cotton ball, which is what I do, and then I wipe away from the center part of my lid to the outside, and that actually irritates and drags all of the extra dead skin cells off of your lashes away